Hey there, this is Luis Moreno with Simply Health Insurance Agency. Hey guys, those of you that have health insurance, whether it's a short-term medical plan, a Christian ministry sharing plan, a limited benefit plan, which are awful, or even an ACA Obamacare marketplace plan, you need to be aware that there is no dental coverage, no vision coverage. If they have something, it's pretty limited. I'm going to share with you what most plans have, and then I'm going to share with you what you should be getting when it comes to dental and vision. But before I do that, guys, with this channel, it is a new channel I'm creating for consumers of health insurance, and I'm going to try to make this the best channel for you guys, but I need your help. I need you to like this video, give me some comments, and also, if you would, please share this with everyone. I would truly appreciate the help. All right, so let's talk about dental and vision insurance. So I'm going to share with you a ACA. So I went in here, and this is a health insurance plan. So I just randomly ran some numbers and came up with a plan that's about a $20 premium plan. Great health insurance carrier, great plan. But let me share with you what these plans have when it comes to dental and vision. So if you go through the summary of benefits of a plan, you're going to see here that there's very little dental and vision. So let's get in here. And usually if they do have any kind of coverage, it is limited to pediatric dental, children's dental, not for the adults. So with this particular plan, take a look at this. Eye exam, no charge. Okay, great. Children's glasses, 25% co-insurance, deductible does not apply. Dental checkup, all that is, there's no charge for a checkup, but there's no coverage for preventative, for basic and major services. So it's kind of not that good. The other problem that I see is that I, as an agent, have trouble with is trying to find a network that a group of doctors that will take these additional benefits that you get with your health insurance. All right, so that's just one plan. Let's go look at a different carrier where that was United Healthcare. Let's go look at Aetna. I look at Aetna, and let's go look at see what they've got. So they do not even cover a dental checkup. And then they have a $10 copay for children's eye exam and for children's glasses. Not bad, okay? Let's go to another carrier here. Let's see here. Let's keep scrolling through this list. Let's go to Oscar. Let's see what they've got. Okay, so we go to Oscar, and let's go look at their same thing here. Children's eye exam, no charge. Glasses, 50% co-insurance, which means you have to split the bill 50-50. And then the dental, no coverage. All right, let's go look at one more. Let's go look at Blue Cross Blue Shield, one of the monsters in the ACA world. Okay, we look at theirs, and let's get in here. Children's eye exam, no charge. Glasses, no charge, up to $75. Not bad, okay? Nothing on the dental. So again, going back to what I was saying is that when it comes to dental and vision, and what you get with your health coverage is literally nothing. And if you have something, it's not that great. So here's what I recommend, guys. You should get a standalone dental and vision plan. All right, I use predominantly one carrier. I love Ameritas. They have a standalone dental, standalone vision, or you can get them together as a package. So I'm going to do a quickie explanation on their 3 dental plans and 2 vision plans. And then you can decide if it's something that's for you. Hit me up. I'll take care of you. We write all over the country. So if you are interested in getting a quote, if you're interested, you can even get your own quote and enroll yourself. Or if you're interested, we can definitely help you out. So let's go take a look at the offerings here. All right. So very easy. I will share this with you guys. Okay. This quote, if you want to just take care of it yourself, you will have this link, and you can take and you can quote yourself, and you can even enroll yourself. All right, so I'm going to plug in the zip code here in town. Okay. All right. You hit the get started. Then it's going to ask you a couple of questions. Do you need dental? Sure. Do you need vision? Excuse me, went too far. Do you need vision? How many people need it? Now, whatever the rates are, this is the way it works. If it's one person, the rates are this. If you get two people, multiply those rates times two. If there's three or more, you're going to multiply that single rate by 3 times. So if it costs $2 for one person, for 2 people, it'll be $4. And for 3 people, it'll be $6. For 4 people, 5 people, it doesn't matter. Beyond 3, you're going to pay 3 times the cost. Okay. But let's just keep it simple. We're going to do one person. All right. So the first thing that pops up here is your dental options. So you have the light plan, you have the boost plan, and you have the complete plan. Okay. The light plan is more of a preventative plan. Okay. It's also the least expensive plan. So on this plan, you have a $50 deductible, and it will cover. Let's get into the highlights. The day that you enroll, if you enroll right now, tomorrow it will start. You have an annual max benefit of $750. It's okay. It's not bad. Okay. And then after a year, it goes up to $1,500. Okay. Now, if we get into, in fact, you know what? I'm going to share. Excuse me. Got asthma and it's kicking my butt. All right, let's get in here. Sorry. All right. I just thought of this. I should have had this ready for you. All right, here we go. This is a better visualizations to see. Okay. All right, so here are the 3 different plans, guys. All right, you have the light, the boost, and the complete. On the light plan, when you start your plan the first year, you only get a total of $750 per person. Then it goes up, after the year is up, it goes up to $1,500. On the boost plan, you start off at $1,500 and then you go up to $2,000 after year 1. On the complete plan, you start at $2,500 and then you go up to $3,000. Not bad. Now, all 3 of these plans have preventative plus. What this means is that whatever the costs are for preventative coverage, it does not eat up into these dollar amounts. With every other carrier that I'm aware of, it will eat into those costs. Okay, so that's a good thing. That means that you have more money there available for basic and major coverage. All right. Now, a preventative is your cleanings. On the light plan, you're going to get, if it's in network, you're going to have 100% coverage. Out of network, 70. Not too bad. On the boost, 100% in network, 80% out of network. And then with the Prime Star Complete, you're going to have 100% in network and 90% out of network. Still very, very good for preventative. Now, basic. Basic, I look at basic as your small stuff. Major is your big stuff. Okay, to give you an idea of what's considered major, you're going to look at oral surgery, root canals, crowns, bridges, dentures, implants. That kind of stuff is considered major. Other stuff is going to fall probably under your basic. All right, so if you're talking about basic and the light plan, the first year it covers 50%. Then it goes up to 80 after year 1. On the boost, it starts at 65, then goes up to 80. And on the complete, it starts at 80, and then after a year, it goes up to 90. So not too bad. Okay. Major. On the light plan, you start off at 10, and then after the year, it goes up to 20. Okay. On the boost, you start off at 20, you go to 50, and the same thing on the Prime Star Complete. Not bad. If you are a younger family with kids, you're going to want to get the boost because you will get $1,000 worth of orthodontia for each kid. Okay, no adult orthodontia. Okay, and then if you are a senior, you're needing hearing aids, The complete is a little bit better plan because you do have a little hearing aid benefit. All right, that's the dental side of the house. On the vision side of the house, we have the choice and the select. We do not have this basic plan over here. Okay, the select and these two plans are very easy to understand, guys. The select is the less expensive plan. It uses the IMED network. The choice uses the VSP network, a much larger network. The biggest difference is that in the select, you get an annual exam with both of them every year. But the biggest difference is that on the select, you get a pair of glasses or contacts one time every 2 years. On the choice, you get contacts or lenses every 12 months. So every 2 years, every year. That's the big difference. Okay. All right, let's look at pricing, guys, because this is where this is what determines whether you want to get this or not. All right, so on the light plan, $21 and change per person. Okay, on the boost, the middle plan, $40 per person. And then on the complete, almost $46 per person. Okay, so again, if it's going to be 2 people, multiply these times 2. And if it's going to be 3 or more, multiply it times 3. On the vision, the select plan, you're looking at about 10 bucks and change. If you're going with the choice, which is the one that gets you a pair of glasses or contacts every year, every 12 months, you're looking at $16. So hopefully that gives you an idea. I will tell you guys, you should have dental and vision. Nothing is cheap. All right. I'm also going to share with you this because I think this is huge. If you haven't been to the dentist lately, I will tell you, those guys aren't cheap. They charge a lot of money. Okay. So I've got a little explanation here for you guys. Check this out. All right. You're going to freak out here with cost, probably, if you haven't been to the dentist, but this is on average. Okay. You have, let's say you were to need a crown. Okay. A crown without insurance would cost you about $1,300 a month. Oh, I'm sorry, for that procedure, just that procedure. Okay. Now, if you had Ameritas and you're in year 1, okay, that rate would drop down to $622. Not bad. So you get an automatic discount just like that because that dentist is in the network. You want to make sure that that dentist and is in the network, and Ameritas network is humongous. All right. Now, in addition to that, you get to knock off 20% off the network rate. So you get it down to $498. So by getting this insurance in year 1, day 1, not year 1, day 1, you save 63%. That alone will pay for your whole plan, probably the entire year with those savings. Now, when you get into year 2, when the percentages go up, it's even cheaper and you get a much larger savings. So not bad, guys, not bad. So here's what I want you to do. If you have health insurance and you're thinking about, getting dental or vision, guys, hit me up. My email is down below. Send me an email and I'll be glad to help you out. Or I'm going to put the link down there for you to quote and enroll if you'd like to. And we would be glad. I've got a team of agents here. Excuse me. I have a team of agents here that would be glad to help you out. All they do is they deal with people with health insurance, dental, and vision all day long. So if you would like some advice, if you'd like to ask us questions, if you'd like for us to help you enroll, we're here for you. I am going to have a link down below that you can click on to book a one-on-one appointment with one of my team members. Guys, I look forward to hearing from you, and thank you. And please don't forget, comment on this video. I do reply to all of them myself. give me a thumbs up. Let's grow this channel, share it with everybody. And the third thing is please, please, please make sure that you subscribe to my channel. I'm going to be posting tons of videos to help you with your health insurance, dental, vision, and anything related to health insurance. Again, thank you very much, guys.